So of the two types of patients that you see, the people with really bad teeth and they're headed for dentures, and then the other group, they're actually already wearing dentures. So when they go to your office, what are the dental implant options?
So the first option is, with 2 or 3 implants, we put little snaps on the denture so that the denture can snap in. So you don't have to use adhesive anymore. They can chew. Yeah, it's going to wobble a little bit, but they can go back to chewing and throw out the adhesive. So they can eat salads and they can eat, a lot of different things. But of course it's going to wobble a little bit because there's going to be maintenance. The snaps need to be replaced. And that's going to be dependent on how quickly they become loose.
Okay.
But a lot of patients opt to do something that's going to be a little bit more stable, which is when we put 4 or 5 implants in, we stick a bar, and then the denture snaps in on top of that. That's going to be, a lot more rock solid. That way they can eat practically whatever they want because it's going to be a lot more solid. You do a lot of those.
I mean, you've done over 100 of those, you said.
Yes, that's a very, very popular option, but they do come out at night, so they're not something that, they can keep in all the time.
But they can eat.
They can eat. Yeah, that's.
What about the upper? Because isn't the suction pretty good
on the
upper?
It's great. We can stick in 4 or 6 implants, do some snaps, and we can even remove the palate because that's generally what the biggest complaint.
On that upper denture.
Yes,
because it's covered.
That's the biggest complaint
mouth.
Because who wants plastic covering the roof of their mouth? It's not comfortable. You generally talk a little bit funny. You can't really even taste your food with that covering the roof of your mouth.
So it's much better. Now, what about the lower? Because I guess, at least it sounds like everybody wants teeth that don't come in and out. Right?
Yes.
You have a snap-in, snap-out option.
Yes.
So tell me about the fixed teeth that don't come out.
That's what everybody really wants. It's going to be a little bit more expensive, but those are the teeth that are actually going to stay in your mouth and not be removed. I always like to say it's a second chance at your natural teeth because it's not something that's going to rock on you. It's not something that you have to take out and put in a cup before you go to bed, but it's the closest thing to your natural teeth again, but without the pain.
How many implants normally to give them a brand new set of teeth that don't come out?
It's going to depend on the patient, but generally it's going to be about 6, maybe 5 implants. But we look at the patient and what it is that they're going to need specifically.
And it doesn't matter if they're 80 or 90 or whatever, they can do it.
Absolutely. Randy, that's the group of people that really benefit the most from this kind of treatment.